want to say thanks for visiting our website, and I wanted to let you know the measures that we are taking to be as proactive as possible with COVID-19 and not passing this along to any of our patients while still maintaining our office being open and available for you guys to work on the musculoskeletal injuries that you do have. Now, the federal government defines physical therapy as a necessary service to help avoid injuries heading to the emergency room that don't belong there. So we feel like we need to be able to be open to help the hospitals out from the overflow that's going to occur from many of the other things that they're going to need to deal with, more so than back pain, right? So we consulted with a couple of physicians from Johns Hopkins to talk about how we can best manage our practices along with you to make sure that we are not passing anything along or decreasing the likelihood of that as much as we possibly can. So here's the standards that we have. So if first of all, if you are sick or you've been around anybody that's been tested positive, we ask you not to come in, for not just for yourself, but for us and anybody else in here. So that's what we're prefacing number one with. None of our staff has been around anybody infected, and we've been following the same standards the entire time that this has been going on. And frankly, we've been following many standards the entire time we've had our practice anyway. So when you come in, you're going to head straight to the bathroom. So you'll head back to the bathroom, don't touch the door, wash your hands. If you have to go to the bathroom, you can go to the bathroom after you wash your hands, you can close the door, but we don't want you to touch the door if you haven't washed your hands yet. So wash your hands, come back. Now once you come back, we are going to take your temperature with a forehead reader and make sure you don't have a fever. So if you have a fever, then you need to head to go get checked out. If you don't have a fever, then we're good. Then we can move forward and start your visit. Now when we start your visit, we use something called Cavicide, which Cavicide is a hospital grade chemical that kills basically everything. So it's so strong we have to use a glove to use it. It kills hepatitis, tuberculosis, it kills corona, everything that's bacterial or virus that we know of, that kills it. This is something that we've used since we started, and you can't even find it anymore because it's necessary in so many other places, but it's what we use for a cleaning standard. So we use that to wipe down anything that any of our patients or we have touched when we first get here and in between visits. We're staggering visits as well. So we don't want people coming in one right after another. So we've actually elongated the visit times that we have, which are already 60 minutes with a patient. So now we have a buffer time in between that, so you're not in contact with somebody else before we can wipe everything down as well. We use gloves anytime that we do any sort of patient contact, so both hands will be gloved up. We're washing our hands in between visits, as we always do as well, and we're avoiding any sort of face contact. So this is the one thing that we don't do much of anyway, but if somebody has a neck injury or their jaw is hurt or something like that, we're avoiding these types of treatments where we're close to your face and you're close to ours, due to the respect of the space that we want to have. That's about the only thing that we've had to avoid. And I think that one thing to be aware of is if you are hurt and you do need to work on this, you totally should, and this is a safe environment. I feel like you have probably a better chance of contracting something going to the grocery store than you do working with us because of the measures that we are taking and also the standards that we have in place to make sure that we have enough time between different people that we're not passing anything along, or we have the least likelihood possible of doing that. We can't really guarantee that because we don't necessarily know if someone's carrying something 100%, but these are the standards that when we consulted with this group of physicians about what we should do, this is what they recommended. Now, for us, we're going to continue to stay open. We're going to have low volume like we always had. We're going to work with people one-on-one so that we can maintain standards with you, help you solve your problems, but also make sure we're being as safe as we possibly can during this time where there's a lot of unknown. So if you're interested in working with us, we're still accepting new patients. It is potentially going to be very limited times that we have available based on spacing things out. But if you're interested in working with us and getting your injury assessed and getting back to the things that you really enjoy, go ahead and click the link to leave us a contact form and the information you have and the injury you have going on, and our team will reach out to you and get you set up as soon as we possibly can.